Good evening and welcome to NBC News. I'm Will McAvoy. It's November now, which means flu season is in full swing. But the fever and aching you've been feeling may be something more severe if you've traveled to a tropical or subtropical area in the past few months. That's because these symptoms are also indicative of the disease called malaria.
Malaria is caused by a mosquito bite with a Plasmodium parasite. You cannot get malaria from casual contact unless it's from an open wound.
Half of the world is at risk of malaria. The symptoms of malaria mimic the many signs of the common cold and flu, which include a fever, nausea and vomiting, fatigue, the chills, and more.
People who are most prone to malaria are young children, pregnant women, and the elderly who have little to no immunity to combat the disease. Ninety percent of malaria deaths occur in sub-Saharan Africa.
Research all your travel destinations prior to departure to check for the occurrences of malaria. Consult with your physician about protective measures. There are some people who should think twice about going into an area infested with malaria, like the immunocompromised, so you may consider not going at all.
Malaria is preventable and curable with the use of the parasite-resistant drug artemisinin.
Sleeping under an insecticidal net,
Using indoor residual spraying as well as insect repellent containing DEET.
And wearing protective clothing are all precautionary ways of preventing malaria.
Be sure to know your symptoms. If you suspect you have symptoms, get tested. Once tested and if positive, start treatment.
Today, we call for the world's attention. Together with awareness, our actions, and compassion, we can stop the vicious spread of malaria.
If you plan on traveling to a country that is known to have malaria, be sure to check out the CDC's website at cdc.gov/malaria for more information on how to prevent and minimize your chances of contracting this potentially lifelong and deadly disease. Thank you for watching NBC News. Good night.